Thank you very much, Madam Chair, and I would like to speak in support of the gentleman from Oklahoma's amendment. First, I'll deal with the Hyde Amendment. The Hyde Amendment is really about whether or not we're going to spend taxpayer dollars for something that's simply objectionable to many taxpayers. As simple as it is. But interestingly enough, you know, we've heard a lot about abortion being health care. Now, I've delivered health care. I've been an chief of obstetric anesthesiology at Johns Hopkins. I was an obstetric anesthesiologist for 27 years before coming to Hopkins, taking care of mothers and their babies in an inner city hospital where 80% of my patients were minorities. I think I know something about health care, delivering health care to women. I was taught that there are two patients. When a woman is pregnant, there are two patients. There's the woman, and there is her baby. And they're separate. I remember reading in my embryology text when I was a medical student that from the moment of conception, there is a human being present. That baby is a human being. Now, maybe abortion is health care for the woman. We could argue that. It's certainly not health care for the baby. It has nearly 100% mortality rate, and the reason I say merely because some abortions are botched, and the babies are born alive. And we discussed that in other bills and other legislation, what to do with that baby. But it certainly is not health care for the baby. And when we talk about the most vulnerable human being on this planet are those babies who are in their mother's wombs, because in many countries in the world, they can be subject to an abortion without their permission. We hear about, well, it's their own body. We shouldn't interfere with a woman because it's their own body. Well, maybe we should refer to science. What does science say about whether that baby is another body? It certainly is a separate body. It certainly is a separate life. It's immunologically protected from the mother because the mother would reject the baby if it weren't, because it is a separate being, a separate human being. I once ran into a pediatrician in my district who said, you know, I disagree with you, Dr. Harris. You should support abortion, especially for poor women, because those babies are more likely to be abused. Wow. I guess the baby doesn't get a say in that, does she? Finally, we've heard it's discriminatory, the Hyde Amendment. Well, let me tell you, ladies and gentlemen, you all know that in 1980, Harris versus McRae, the Supreme Court decided it was not discriminatory. That's 7 years after Roe v. Wade. The Supreme Court actually decided it's not discriminatory. I'm going to end by talking about the Weldon Amendment, because for me, that's very personal. Madam Chair, you said a patient's well-being should always come first. I'll just reiterate. There are two patients involved. It's the mother and the baby. And if I, because of my religious belief, not a preference, as the gentlelady from California suggested, my religious belief that that second human being deserves protection, and I cannot participate in taking that second human being's life, my religious belief should be respected, because my religious belief is not in the penumbra of the Constitution, as Roe v. Wade referred. It is actually in the First Amendment. Madam Chair, you mentioned insurance companies, you mentioned institutions, and you're right, Weldon applies to them. But my gravest concern is individuals, because we know about Kathy DiCarlo in New York, Mount Sinai Hospital, forced to participate in a second trimester abortion where she had to count the body parts, even though she had told her supervisor she has a religious objection to participation. She was forced to participate, and subsequently, because she had to file a lawsuit, Mount Sinai changed their regulations. It's not about a provider's preference, it's about a provider's religious belief. As Americans, we should respect every individual's belief. That's what Weldon does. Madam Chair, I strongly urge adoption of the gentleman from Oklahoma's amendment, and I yield back.